Whilst we have formally already acknowledged the traditional custodians of the land which we gathered today, I would like to pay my respects to elders past, present and emerging. I also acknowledge their deep connection to land and water and culture, and extend that respect to any Aboriginal or Torres Strait Islander people in the room today. At Vita Health, we are committed to working in a respectful partnership with First Peoples. We are embedding cultural safety in our infrastructure, not just as a gesture, but as a practice. Whether through welcoming spaces, culturally significant design or co-design processes, we are learning and still continue to learn how to build better together. There's a bit of a lag. Okay, no. Okay, although my name's Lisa Antonio, my career with the state government spans a 30-year period with social infrastructure delivery both in the justice setting and health dominating the past 15 years. My experience mostly relates to delivery, so at the back end, high-value, high-risk projects at a portfolio level in a complex operating environment. However, my current portfolio, I oversee the technical advisory services area, giving multidisciplinary specialist teams, across a diverse range of functions aimed at improving outcomes. Specifically, my current portfolio, I lead the engineering, sustainability, planning and property teams, design services, digital build, and the very important design reform. So who we are. You've probably heard VHBA, you might have heard Vita Health. The Victorian Infrastructure Delivery Authority delivers the state's transport and health infrastructure programs. This includes more than 200 projects, Metro Tunnel, North East Link, Westgate Tunnel, removal of 110 level crossings, buildings, and building new hospitals and upgrades to ambulance stations, specialist health services and early parenting centres. Vita is made up of 4 project offices: Vita Rail, Vita Road, Vita Metro, and importantly, Vita Health. So Vita, historically that's what we were called, we now have a branding, Vita Health. And we deliver crucial in health infrastructure projects. Although we have been formally moved out of the Department of Health within the Victorian Government, we still work hand in glove with the newly established client office that sets system planning and leads network and asset planning. Bit of an overview in regards to the projects. So I'm having a little bit of trouble with our... There we go. Just 5 years ago, health infrastructure investment in Victoria sat close to $3 billion. Currently delivering 68 funded initiatives across 5 different portfolios, including health, ambulance, aged care, children's services and mental health. Our current portfolio exceeds $15 billion, and that's in a 5-year period. This is the most significant, unprecedented coordinated investment in public health infrastructure in Victorian history. And it comes at a crucial time when our health system is responding to population growth, demographic change, and new and evolving models of care. We are targeting investment to meet system demand now and in the future. Just some highlights of some of the projects that we are delivering, a quick overview. So in metropolitan Melbourne, in the west, we are delivering the new Footscray Hospital, which is a $2 billion investment in western part of Victoria that will replace the current facility and deliver a world-class teaching and tertiary hospital. I understand as a part of the conference last year, a number of members here might have attended the Footscray site and had a look at the progress. This new hospital will increase capacity to 500 beds, enable around 15,000 more patient treatments per year, provide a new ED, operating theatres, ICU, imaging, pharmacy, pathology and much more, significantly reducing pressure on the surrounding hospitals. The project is nearing completion, with major construction concluded and operational commissioning activities underway, which is scheduled to officially open the new Footscray Hospital and treat patients from February 2026. In the southwest, we're delivering the Frankston Hospital redevelopment, the largest ever health investment in the southwest region. It will expand maternity, paediatric and women's health services, deliver more acute and elective surgery capacity, and importantly support approximately 30,000 more presentations a year. In central Melbourne, we're shaping the next phase of the Parkville precinct with a $2.3 billion investment to deliver the first stage of that redevelopment for the existing Royal Melbourne Hospital and the Royal Women's. We are also expanding in Metro Melbourne the Monash Medical Centre, the Northern Hospital and Austin Hospital's ED. These projects are all part of a broader strategic vision to modernise our metropolitan health infrastructure in ways that align with growing catchments, emerging clinical needs and the long-term demands of complex care. Regional Victoria, very important. I'm a regional girl myself. They deserve the same quality of care, the same modern facilities and the same confidence in their health system as anyone from Metro. Creating opportunities for Victorians to receive care closer to home. That's why our project portfolio includes major regional redevelopments, including the Ballarat Base Hospital, which is a new redevelopment which is delivering a multi-level tower with theatres, ICUs and inpatient beds, a new pharmacy, pathology, imaging and education centre, which will accommodate approximately 4,000 additional surgeries a year. The Barwon Women's and Children's Project, which will deliver a much-needed and expanded women and children's facilities in the Geelong region, designed for the growing population of the Geelong Southwest region, providing care closer to home for thousands of families. The Maryborough and District Hospital recently completed. Staff and patients have moved into this new modern facility that brings together acute care, urgent care, imaging, day surgery, pathology and allied health. Warrnambool Base Hospital also undergoing a major redevelopment, transforming services for the southwest region and more. Our investment in the regions includes works in Echuca, Mildura, Swan Hill, Albury, Wodonga, Shepherd and Traralgon. So we really are covering the full range of both regional and rural Victoria. This next slide is a very small representation of Vida Health projects, but it highlights our impact, and it's not just about hospitals. We are delivering the infrastructure that supports care throughout the entire life journey. With the help of many in this room, we deliver mental health. Following the 2021 Royal Commission into Mental Health, we are implementing a significant mental health infrastructure reform agenda, including 8 new or upgraded youth prevention and recovery centres, YPARCs. The expansion of the acute mental health beds across the state, specifically the redevelopment of the Thomas Emmerling Hospital in Fairfield to better serve forensic mental health needs. These facilities are designed with dignity and recovery of patients in mind, and they embrace trauma-informed design and lived experience input, which creates greater spaces for healing. We've actually just handed over the 82 additional points of care as a part of that project. Early parenting centres. Our early parenting centre program is tripling the number of centres across Victoria. These centres support sleep, settling, feeding and parental wellbeing. They are warm, welcoming and designed with new families in mind. Our aged care. We are delivering 8 residential aged care projects aligned with best practice recommendations from the Royal Commission into aged care quality and safety. This includes small household models with 4 or 5 residents, curated with private rooms, including en suites. New spaces that feel more like homes, not institutions, and most are located in regional communities where ageing in place is essential. Our ambulance branches. The Victorian Government, since 2015, has committed more than $280 million through the Ambulance Victoria Development Program to upgrade and rebuild ambulance branches. This investment provides better working conditions for paramedics and ensures life-saving emergency care is available for all Victorians. So since 2015, 47 new branches have been delivered and 4 are currently in the planning and development stage. Lastly, but certainly not least, is our grants program. On behalf of the Department of Health, Vida Health are delivering 180 grants across Victoria. This includes some of our asset replacement and energy efficiency programs, where our teams work very closely with the relevant health agency to deliver those funded projects. The grants program includes both regional and metropolitan health infrastructure funds, with a total estimated investment of circa $500 million. Sustainability. Whether it's high risk project or a grant allocation for a small health agency in rural Victoria, a critical part of our project delivery approach is embedding sustainability from planning through to asset management. So sustainability for us isn't a nice to have, it's a core priority. Our goal is to maximise the social, environmental and financial outcomes throughout the asset lifecycle, not just the project lifecycle. And to that end, we have in our budget and our cost plans a build-up of an allowance for our sustainability. Through addressing sustainability early in the design process and throughout the project lifecycle, we support health system resilience and decarbonisation, all while ensuring the safety and comfort of patients and staff. Social sustainability. From a social perspective, Vida Health places strong emphasis on patient and user experience, recognising that health infrastructure should not only be functional, but also support healing, dignity and wellbeing. We embed the principles of biophilic design from the earliest stages of planning. Improving the working environment contributes to morale, productivity and retention, critical challenges across our healthcare workforce. From an environmental perspective, Vida has a key goal across all project offices to reduce the embodied carbon in our infrastructure, also known as upfront carbon. This includes the emissions associated with materials and construction before a building is even operational. A key reason I'm here speaking today is our CEO, Priscilla Radice, was actually unavailable to attend, and the reason Priscilla was unable to attend is she actually delivered a keynote speech at the Ecologic Green Infrastructure Conference, sharing our vision for sustainable health infrastructure in Victoria. During her address this morning, Priscilla released our new Net Zero Building Handbook. This initiative is the first of its kind in the delivery space for a delivery agency in Australia to directly set whole-of-life carbon reduction targets for its projects, an important step towards a greener, healthier community. The VHBA Net Zero Building Handbook is now live on our website, so please feel free to download a copy and help us to continue the important work of decarbonising Victoria's world-class health infrastructure. In the world of technology and innovation, we have a clear objective: digitalise how we deliver Victorian health infrastructure through digital build and data, empowering people, streamlining processes and leveraging technologies to drive long-term impact. While building information modelling, BIM, plays a role, it's one of a piece of much broader digital build strategies, with rethinking the entire stack from workflows to intelligence to system integration. Design principles. With such a wide range of projects, consistency matters. That's why we are reviewing and updating our technical and design guidelines. We're embedding a set of VHBA-wide standard design principles, driving repeatability in components like staff stations, room sizes and services, using prefabrication to reduce costs, waste and time wherever possible and practical. This doesn't mean every facility should look the same. It means common infrastructure where it makes sense and bespoke design where it matters most. We want to create environments that are equitable and flexible, simple and intuitive, mindful of size and easy to move through, that allow evolving models of care that work both now and into the future. VHBA, Future Fit. Looking ahead, our priorities are clear. We are strengthening our design principles and standardising core components across projects. We are embedding digital health readiness in every build. We are aligning our projects with network service planning and future models of care. We are deepening partnerships across government, industry, health services and community. And we are continuing to invest in capability, both our own and across the sector. A consistent and continued focus on these priorities will assist in the delivery of a world-leading healthcare outcomes that our communities need and deserve, and that we can all aspire to. Decisions made at the bricks and mortar stage will make all the difference when someone requires the best of care. What we deliver today must enable the healthcare of tomorrow. That means places where care is safer, efficient and more respectful, buildings that support our workforce, and embedding research and lessons learned into our design, something obviously Jacqueline, Sarah and Rebecca spoke about earlier. Let me finish by saying this. Infrastructure doesn't deliver healthcare, people do. But the places we build matter because they shape how care is delivered. They enable healing, they attract and retain staff, they serve communities for decades. At Vita Health, we're proud to be delivering the projects that make this possible. Together, and I mean that collectively from this room, we are building the healthcare of tomorrow, today. Thank you.